Thank you very much, Chairman Booker. It is good to be with all of you. I appreciate the testimony of everyone. Ms. O'Connor, my daughter lives in Philadelphia, so I'm very glad that your husband's family and your family have been protecting that community through multiple generations. And I just wanted to express my appreciation for their service. It is not at all, as you know, uncommon for police work to be passed on from father to son and now daughter, and be a very important part of a family's traditions. And I am grateful that you shared your experience with us today. Senator Cornyn and I have been working for some time on a bill to improve the coordination between law enforcement and behavioral health, mental health, addiction and recovery. Both of our states have similar situations, although they're different in many, many, many ways. One of John's sheriffs came to him and said, "You know, John, I'm providing more mental health services than I'm providing law enforcement services, and that's not what we're trained for." And my police chiefs in Rhode Island tell me the same thing. And I think the problem reaches across a whole variety of areas. First of all, at the point of engagement with an individual, to have the crisis intervention teams and have the crisis intervention centers available so that there can be a timely and appropriate response to support the police response is essential. Mr. Martone talked about how jails are too often the default collection point for individuals having a behavioral or mental health crisis or an addiction issue. We see that in Rhode Island as well. We also see our emergency rooms as another place where people are brought. And for emergency room doctors trying to deal with regular medical emergencies, this is not appropriate. They need to be in behavioral health treatment and quickly. And the reason that the jails and the emergency rooms are playing that role in Rhode Island anyway is not because people are misdirected about where folks should go. It's because there aren't the behavioral and mental health services and resources to meet the need. So we need to not only do a lot of crisis intervention support and develop new models for supporting police departments with behavioral health crisis intervention, but we need to make it a lot more robust in terms of the resources for those people. Someone in a non-police involved mental health crisis who goes to the emergency room in many places, including in Providence, Rhode Island, can spend days waiting in the emergency room for services or a room to become available. So the whole question of how much we invest in the necessary infrastructure is a really vital part of this conversation. I'd like to add that I was delighted to hear Senator Cornyn mention mental health courts, because we're working, our district court chief judge, Judge LaFazia, who was instrumental in supporting the growth of our Veterans Court, which stood on the record that the Superior Court had in a program I started when I was Attorney General of having a drug court. And I think the mental health court is a really good idea. But as we look around for how do you resource that, there are not a lot of resources. So taking the idea of mental health courts to stand on drug courts and veteran courts experience, I think is another aspect that we have to work on. I want to invite all colleagues to join Senator Cornyn and I in working on that measure. We've worked together successfully before on the reentry measures that were part of the sentencing reform bill. And we hope very much to get a significant piece of legislation put together. What I would ask the witnesses to do is to share with us what, from your experience, you think are the best practical models that you've seen whether in your own state and your own jurisdiction, or whether because this is your field of inquiry, you're aware of really good examples that are taking place in other states and other jurisdictions around the country. And I will ask that as a question for the record, if you all don't mind. There'll be a week or so after the close of the hearing when Chairman Booker will allow written answers to questions for the record. And if you don't mind writing down a brief summary of what you think are the best examples of behavioral health coordination with law enforcement, or the best way for engaging with this population and successfully dealing with de-escalation. We would love to know, because the broader the support that we can get from states where there are really good examples, the broader the base for legislation grows in the Senate, and the more likely we can get something big done. So I'll close with that. Real gratitude to all of the witnesses, each of whom made a very special contribution to our understanding and to this hearing. And to the extent you wouldn't mind supplementing that with a list of what you think best practices are out there, I think we'd be very grateful as we pull this legislation together. Chairman Booker, thank you for this terrific hearing, and I will yield back whatever time I have remaining.